Is just going to say a few words briefly, and then we'll go ahead and get started with the rest of the program.
Hello, how's everyone? I may not be looking directly at the camera. Students, residents, welcome. So for those of you that don't know me, I'm a president this year for NJAOPS. It's a pleasure to be out here. I'm normally up in the central Jersey area, go between Monmouth and Mercer, and actually make a point of going to every county. So this is my second trip down south. I was in Burlington, Camden, I think a month or two ago. And hopefully, if time allows, I'll make a second trip around. So trying to do that. For those of you that were commenting on the journal that's out and our website, we've really tried to revamp a lot of things. Leanne, when she was president a few years ago, really tried to reach out to the members. And I think our website, based on some of the limitations we had, maybe cost some limitations in the interactive, but the approach was there, and that's something that I wanted to continue in reaching out to the members. I'm not as ambitious in trying to do a daily blog. I really don't have time, so I'd love to. But I do have email, Twitter, internet, and every other way you want to communicate with me. I would love that. I'm about being in the trenches and just, I'm a practicing physician like everybody else, and it's really our members' needs are most important to me. So a lot of times I always hear, well, it's for primary care, that's what NJAOPS is. It's not, it's for everybody. And any physician, if you have DO after your name, and if you don't have DO after your name, if you want to be associated with the best association that the state has to offer, NJAOPS is it. And it's about communication this year, about trying to get out to our members, it's about technology, doing things like online CME. This is actually our first program, and we thank our speakers for being our, we'll say guinea pigs, but I don't think it's going to be the case. We're really trying to, it's hard for physicians that are practicing to get out and go to live CMEs all the time. This gives another alternative option for people that are asking for this. How do we do live CME or tape CME? And so this is our, one approach to doing that. So any ideas that a member has, big or small, we're going to listen to it and hopefully implement it. We have a lot of great things that we've been doing up and down the state. Doug is our chairperson for our drug and dispensing committee. It's a task force that's looked at ways to utilize electronic medical records to prescribe medications, as well as the latest bill, which I think everyone might be aware of now. Hopefully, it's on our website and it was in our journal, but about the ability to prescribe controlled meds. Is everybody aware of that? Does anybody have any questions about it? Anybody not know what I'm talking about? Good. So you're doing
Go October 1st. Go ahead, go through your spiel.
No, so come October 1st, I'm going to say now. Let's just say now.
Okay,
What you should be doing right now is every time that you're about to prescribe a controlled medicine, and by controlled medicine, that's Schedule 2. And I would go a step further and just tell you to do anything at Schedule 3 or 4. Just get into the habit, But definitely Schedule 2 drugs. You must absolutely check your website. Check the PMP, the Prescription Monitoring Program website, the Jersey RX website, every time you're going to initiate a new prescription for a patient. Anytime you have a patient that's coming back and you're doing continued treatment, so anything above 7 days of prescribing, you need to check that PMP. And if you have a patient you've been taking care of for years and you think, this patient's fine, I know this patient, I have no worries, think again. All right? And they may be legit, I'm sure they are, but this is to protect you and it's to protect the patient. So that's one. 2, October 1st is also magical ICD-10 date. So NJAOPS and many other states and medical associations lobby, very heavily for them to delay the penalties. Not to delay ICD-10, we'd love that to go away, but the penalties, if you're an outpatient doctor and you don't code the ICD-10 exactly the right way, you're not going to get penalized. If you use an ICD-9 code, you're just not going to get paid. So if you use ICD-10, you're going to get paid, you just won't get penalized. If you're in a hospital, however, if you don't use the ICD-10 codes that are correct and the right procedure codes, that might be a different story. So for anyone that's in the hospital, pay attention to that. We are working on having a webinar as well on ICD-10. I know that's something that John, I know we had someone that was going to do it and that fell through, and we have another.
I think we have somebody else now.
Yeah, so we have something that's lined up. So between now and October 1st, NJAOPS will have a webinar. AOA and ACOP are also hosting webinars, so in case you don't want the local flavor, we'll also have the national connections as well. AROC is underway for planning for next year. McLean and DeSanti, our incoming president-elect, She's an obstetrician from North Jersey, and she is actually, it's going to be, if you didn't guess, women's health will be the focus. There will be other topics, many other topics, but that will be the focus. For those people that are not FMCSA or CDL certified to do medical examinations, we are going to have a one-day course on September 19th again. So that's a 7-hour course, and then you'll take the exam at a date later than that. I would encourage anybody that hasn't done that to do it. You don't have to be primary care, so any doctor can do this. Does anybody have any questions about anything? All right, for students, residents, oh sorry, one more. Students, residents, and anyone else that wants to get involved, this year we created additional committee spots for students and residents, and then we have some unfilled spots for attending physicians. If you'll get any of our committees, whether it be government affairs, some have to be elected, like ethics committee and membership, but government affairs, managed care, membership, public affairs, public relations, OMT committee, the committee for AROC planning. There's a lot of different opportunities. So if you say, hey, I'd like to be involved, I'm not sure if I want to be an officer or a county officer, this is a good way to just get involved. And it is a good stepping stone if you want to see, hey, would I like to do something later on? There's plenty of opportunities. So if you are interested, we are taking nominations now at our board meeting coming up September 16th. Those nominations will be sealed, signed, and delivered, and you'll have to wait till next year. So if you are interested, you can send an email to me with your CV and letter of intent at president@njosteo.com. President@njosteo.com. I'm sorry.
Couple things.
Yeah.
Where is the AROC going to be?
It will be in Valleys again.
Same thing.
Yes.
And with the NJ, with the monitoring, are the pharmacists required to also check that
The PMP is mostly for physicians to check, but pharmacists have their own criteria. I'm not sure if this particular bill relates to pharmacists. I don't know, Doug, if you can comment on that.
It made them, although their requirements were already above this, but they have to input the data. They required it weekly, but they're already generally doing it for the most part on a daily basis. So they have to input the data, and then it's up to us to check it. But they have their own system.
It's going to be scheduled 2.
Definitely scheduled 2.
Definitely scheduled 2.
The others are optional, but schedule 2 is 3.
Schedule 2 is what
Even a
the,
refill, even a renewal.
yeah, Schedule 2 is where the law is. I'm saying that you never know what will happen next. I feel best practice is any control medication, no matter what schedule you should be doing it. Because those other medications, let's say Xanax, for example, that's on, any prescription will show up there. So it's a good idea that a patient may be coming in asking you for oxycodone, but for all you know, they may have a Xanax ring going on. They're just using your oxycodone prescription to buy and sell more Xanax. So it's a good idea to see what else they're doing out there.
And the requirement
And
of new
also-
patient
yeah.
every quarterly.
Yes.
Is mandated.
For chronic refills.
Oh, it's quarterly.
Yeah,
Right.
but I will
Not every refill.
I will also tell you that, so I've been to several programs on pain management prescribing up and down the state, like for not just CME, but just other programs involving the DEA. I will tell you that one of the biggest things that have come out of this that I've learned is you really should be checking yourselves on this website. So you can go on and see every prescription you've ever written. You can put in the time frame you want. And it's actually been very helpful because I went back and found a few patients. Fortunately, I didn't find anyone that was abusing, but I found patients where I never seen them. And for some reason, my name was tagged to them. And in some cases, I had a partner in my practice that prescribed it, but a pharmacy used my DEA to prescribe it, to do it. I have no idea why. I called the pharmacist and they said, oh, I was a covering pharmacist. They made a mistake, and they kept refilling it under my name. So things like that, I put a stop to it. I said, look, it's my DEA, you can't do that, And so in that case, it's a pharmacist error. But I didn't find any deviant activity on my, someone was abusing my prescriptions, so that's good. But you definitely should check yourselves.
Also, I've had some incidents where they spelled the name wrong in the pharmacy, and when you put it in the PMP, it doesn't show up. And I had one recently where I knew the patient was taking the narcotic and was using it because they're a cancer patient, and I couldn't pull them up on the PMP,
Wow.
and I finally called the pharmacy and asked what address they were using, and then found out when I talked to the wife, that address has not been used in like 10 years. So I mean, so you really have to sometimes do a hunt for some of these things.
Well, and you're right, and that would be a case if you check yourself, you would find them with different spelling, and then that's another way to investigate. So,
Oh, I didn't know
you know what I mean? So if you check yourself, anything that you prescribe for any patient despite spelling, that will show up. So, anybody have any other questions?
How was AOA House of Delegates?
AOA House of Delegates was excellent, thank you. We actually, sorry that the TriCounty contingency
we
minus
forgot
Todd,
reference.
you know, he was
Todd,
there.
yes.
You know, so we, every July we have the House of Delegates, AOA House of Delegates, and we had 20 delegates from our state, 2 students, and of course our executive director was there. And we had other New Jersey representatives there, but they were representing other organizations. So Dr. Franks was there representing sports medicine, Dr. Maurer was there representing rheumatology, and then Dr. What's that? Scheinfeld was there with BOS for the specialist. So, you know, we had a lot of great representation. It was actually, you know, having been to, I think, at least 15 to 18 of these meetings now in Chicago, this was one of the better run ones. It was the last time it was held in Fairmont. It was kind of bittersweet, but, you know, very organized very well. There was no fireworks within our delegation. You know, we were very organized, you know, a lot of camaraderie, and it was great. A lot of key bills and things were passed. I highlighted some of them on my message, but, you know, some of the things, it was great. Actually, a lot of resolutions that came out were brought by SOMA and CSGP, and they were really great. One was about the depression and suicide, about attending more attention to depression and suicide for medical students and medical professionals. That was something that we're all aware of, but there was a bill actually looking at that, or a resolution. There were other key resolutions about, you know, right now a lot of us precept and take students and residents in our office and you don't get reimbursed. So there's actually a resolution that was passed to look at the possibility of getting tax breaks, you know, to be an instructor, which was pretty nice as well. So there are a lot of good resolutions. I don't know if you have questions about any specific ones or anything like that. So, all right, and they have a busy program with the lectures today. And again, thank you for inviting me. And if you have any questions at any point outside this and you're shy, or you just like to email, and just get in touch with me, and I'll be here all night. All right, thanks.